name is Mallory Romano, and today I'm going to be talking about caregiver perspective. The quote, "If stress burned calories, then I'd be a supermodel," is a quote that all of us can relate to. As college students, we know how high stress levels can affect our mood and our willingness to participate, and can even eventually lead to emotional exhaustion. We aren't the only ones feeling this way. Nurses have an extremely stressful job, and most of the stress comes from their fellow work members. Having two ancillary nurses has given me insight into how emotionally hard nursing is on the body. After further researching the cause and effects of nurse burnout, I can begin to understand the nurse frustration of not being treated with the respect that they deserve. Today, I'm hoping to give you some of this insight into why nurses are emotionally exhausted from the lack of respect and communication with their peers. What exactly is burnout? The term burnout is interchangeable with the term emotionally exhausted. According to the textbook, burnout is a combination of many things, such as emotional exhaustion, depersonalization, and the reduced sense of personal accomplishment. Burnout is not an uncommon thing among the nurse community. In fact, many nurses fall into this due to the high stress levels of their job. Studies conducted among nurses show that the interpersonal communication should help reduce an emotional exhaustion. The communication between a nurse and a physician is very important. An evaluation of patient outcomes from 13 different hospitals shows that the importance between an excellent hospital and a poor hospital is the quality of communication between the physician and the nurses. The key component to any team is communication. There is less report of stress among nurses when they feel that they have some control over the work environment or when they are included in decision makings of patient care. Communication between a nurse and a physician usually influences burnout because a physician does not always do his part in communication. When a physician does not do his part in communication, the nurse is then left with the responsibility to assert herself. A nurse's assertiveness is a key component to empowerment. Usually, a nurse is not allowed to say her opinion of patient care unless the doctor asks for it. But if a nurse never speaks up and says it, then the physician will never acknowledge her. This stress and feeling unappreciated pushes a nurse closer to burnout. The hypothesized model says that nurses who have higher levels of emotional exhaustion are less likely to be committed to the hospital, and those nurses who feel decreased levels of commitment will be less likely to stay at the hospital. We now have a clear understanding of what burnout is and how nurse and physician communication should be. So we can now talk about a survey that was conducted amongst nurses and their relationship with the physicians. For this survey, data was gathered from nurses who worked at a hospital in the Midwest, and it tested the hypothesized model we just talked about. The hospital is an average-sized facility that has 25 patient care units, 3,500 staff members, and 400 physicians. The largest group of employees is the part-time and full-time registered nurses and licensed practitioners. They make up 1,356 of the 3,500 staff members. The procedure of the survey is quite simple. It is broken down into two steps. First, the focus group interviews, and second, the questionnaires. Once the names are picked, letters were sent to the nurse managers and then to the nurses asking for their participation in the interviews. These interviews gave us more details on relative issues and also allowed us to ask follow-up questions. Each focus group had a principal investigator and the nurses for that focus group. The principal investigator noted the nurses' responses and then the reoccurring themes that they talked about in the interview. He then used those themes along with previous research to put together the second part of the survey, which is the questionnaire. All 1,356 employed nurses received this questionnaire and had the option to fill it out, seal it, and return it. The return questionnaires were then collected to be analyzed. Of the 100 names picked, only 30 nurses participated in the focus group interviews. The principal investigator noted that there were 7 recurring themes in the interviews. Those themes were participation in patient care decision, lack of understanding of professional nursing, listening, respect, time, public contradiction of the nurse, and physical help with chores associated with the patient care. The principal investigator realized that the most discussed issue was the participation in patient care decisions. From the interview results, we begin to see that our previous talk of physicians not doing their part in communication is actually true. 1,356 questionnaires were distributed to the nurses in the hospital, but only 492 were returned. Once analyzed, these questions indicated that the hypothesized model that we talked about was in fact very close to the data that they received. The model was then adjusted to fit the data results. We now know what burnout is, we know how communication between physician and nurse is supposed to be, and we now know how physician-nurse communication really is from the surveys. Now that we have the surveys to compare real-life situations to what we think is happening, we can now tie the two together. Our results from the survey and the interviews tell us that the physicians are not doing their part in communicating with the nurses. This lack of communication puts a stress on nurses emotionally and can potentially cause a problem with patient care. Deliberately not communicating with the nurses can lead them to assume that they are not needed in the workplace and can potentially bring them into the hypothesized model that we previously talked about. Participation in decision making and asserting oneself are confidence boosters that nurses deserve to have. Personal control was a big part of theorizing communication and social support in the workplace for this survey. Personal control is also important when considering empowerment as an important influence to the participation of decision making. Through this research, it was concluded that personal control does play a role in connecting perception of participation and emotional exhaustion, but this role can be smaller than what was previously thought. The model was then revised to fit the smaller role of personal communication. The role of nurse assertiveness has an important part in keeping a nurse from being emotionally exhausted. It was already established that physicians do not do their part in communication, which can put a burden on nurses who want to do their job and want to do their job well. It is important that nurses feel appreciated and wanted to ensure that they do not become emotionally exhausted from dealing with the stress and emotions of always having to be the one to communicate. The topics discussed today are just the tip of the iceberg, but we can conclude that communication is a very big part in why nurses are feeling burnt out. We've talked about what physician-nurse communication should be and why it causes nurse burnout. We then walked through a survey of actual physician-nurse communication problems that proved the lack of respect. We finally compared the survey results with how communication should be between physician and nurses. I hope that this gave you some insight into why nursing is such an emotionally hard job and reasons why nurses feel underappreciated. Many of us are pre-med or planning going into the medical field. So I will leave you with this one question. Will you be part of a nurse's emotional exhaustion or will you be part of building that nurse up?